Now we continue with the back transporting points, the Shu points, and its uses. The back transporting points can be used in both acute or chronic conditions, but are more frequently used in chronic ones. The back transporting points are yang in character and are especially used to tonify the yang. However, they can be used for deficiency of yin as well. Chapter 67 of the Classic of Difficulties says, yin diseases move to the yang area, yang diseases move to the yin area. The front collecting move points are situated on the yin surface and therefore treat the yang diseases. The back transporting points are situated on the yang surface and therefore treat the yin diseases. According to this statement, the back transporting points should be used to treat yin diseases and the front collecting points, the yang diseases. Yin diseases can mean either diseases of the yin organs or diseases characterized by cold. This would therefore mean that the back transporting points would be used to tonify the yin organs and to warm. Conversely, yang diseases can mean either diseases of the yang organ or diseases characterized by the heat. This would therefore mean that the front collecting points would be used to nourish yin or to clear heat. These guidelines are certainly valid, but they should not be adhered to rigidly. In other words, the back transporting points can also be used to tonify the yin organ and clear heat, and conversely, the front collecting points can be used also to tonify the yang and to warm. Yet another interpretation of yin or yang diseases could be that of chronic or acute diseases, respectively. In this interpretation, the back transporting points would be used for yin diseases, either chronic diseases, and the front collecting points for yang diseases, like acute diseases. Although this rule should not be interpreted rigidly, it is certainly a valid rule which finds a widespread clinical application, that is, using the back transporting points for chronic and the front collecting points for acute diseases. We have here at the table the clinical use of back transporting and the front collecting points. In chapter 67 of the Classic of Difficulties, for the back transporting points, it is used for yin diseases and the front collecting points for yang diseases. For the organs, the back transporting points, it is for the yin or diseases of the yin organs, and for the front collecting points, it is for the diseases of the yang organs. For the heat and cold, the back transporting points is for the cold syndromes to warm the organs, and the front collecting points is for the heat syndromes to clear the heat. The duration of disease, the back transporting points is chronic diseases, and the front collecting points, acute diseases. Another characteristics of these points is that they are used to affect the sense organ of the corresponding organ. For example, bladder 18 is the back transporting points of the liver and can be used for eye diseases. In practice, the back transporting points tend to produce a stronger effect than the front collecting points. They are therefore very useful when the patient feels very tired, exhausted, or depressed. In these cases, if the stomach and spleen are deficient, for example, the use of bladder 20 and bladder 21 will produce a strong tonifying effect. The use of bladder 17, bladder 19, in Chinese called the 4 flowers, also has a strong tonifying effect on qi and blood. The point bladder 23 should be used in any deficiency of the kidneys, particularly kidney yang, as it strongly tonifies the kidney. Although the back transporting points are mostly used to tonify the organs, they can also be used in excess pattern to expel pathogenic factors. In particular, they can be used to subdue rebellious qi and clear heat. For example, the point bladder 21 can be used to subdue rebellious stomach qi in case of belching, nausea, or vomiting. The point bladder 18 can be used to remove stagnant liver qi. Bladder 15 can be used to clear heart fire. Bladder 13 to stimulate the diffusing and descending of lung qi and release exterior. Thank you for your attention.